Good afternoon, everyone. We will get started in just a couple of minutes. Thank you for those who are logging in. I think we can get started. It's a wonderful day here in Washington, D.C. It's a pleasure to have everyone logging in for our June Regional Champions webinar. And I want to introduce myself. I'm Kimberly Beer. I'm the Senior Director of Public Policy here at the Foundation. And I know it's been a while since we've last connected. I honestly can't believe we're halfway through the year. And I want to first acknowledge Pride Month. Happy Pride Month. I know we're closing it out, and I hope that you have taken some time to participate in some of the activities the Foundation has done throughout the month through our blogs and webinars. We really appreciate our LGBTQ plus community and hope that you feel connected to the Foundation, and please always reach out for any questions and support. I want to thank our advocates who continue to show up every month and heed our calls to action. I know many of you are deeply rooted in your own communities and are active at the local level. And I just want to really share my appreciation for your continued advocacy at the federal level. And very excitingly, we're days away from Disability Pride Month that starts in July, along with Happy July 4th. It'll be a month-long celebration of all things disability, about disability, access, and inclusion. And throughout the month, the Foundation will look forward to joining together to discuss how we can ensure that the ADA is fulfilling its promise, and also ways in which we can continue to improve this very important piece of legislation. We want to ensure full opportunities, full participation, independent living, and economic self-sufficiency for all. A little bit of some housekeeping items. We will record this webinar, as we always do. We will post it on our YouTube channel. If you've missed some past webinars, I think our last one was in March, you'll find the recordings there. We will also monitor our Q&A section, and throughout the webinar, I'll do my best to monitor those and answer them as appropriate. We will follow up with a post-webinar email, which will include the recording as well as any outstanding questions we may not have answered, with some updates from our public policy team. So why don't we go ahead and get started? I'm so grateful to welcome my colleagues with me. Before I introduce them, I'll talk a little bit about what we're going to address today. We have a lot to update and a lot to review with all of you today, not only in reference to the Foundation's priorities, but also what's happening in Washington that seems to be changing on a daily basis. And we want to make sure you have all the information and answer any questions you may have. We'll first address some of the Supreme Court updates and decisions that we've seen in the last week or so that continue to be released this coming week before they adjourn. We'll talk about congressional updates. There's many legislative updates, as well as some updates around our funding priorities that include the National Paralysis Resource Center. And of course, we'll end with our grassroots activities. We'll talk about some recent events we held here in Washington, some upcoming events that you could participate in, as well as also some action alerts that you'll be finding in your inbox soon. If I could introduce my colleagues, of course, again, I'm Kimberly Beer. It's a pleasure as always to be here. My wonderful colleagues at Waxman Strategies, Celicia Lomax and John Sawyer. And as well, I'm thrilled to welcome our new colleague here at the Christopher and Dana Reeve Foundation as our brand new public policy manager, Angel Hines, who is living in Chicago, but will be visiting Washington often, as well as our New Jersey headquarters. We're thrilled to have her. I'd like to just have her introduce herself briefly before we get started. Angel?
Thank you so much, Kim. Hi, everyone. I'm so excited to be here for my first Regional Champions webinar. I just started last week and I hit the ground running and have been learning quite a bit about the Reeve Foundation from Kim, and I'm really just thrilled to be here. Just a quick background on me. Like Kim said, I am in Chicago, but we'll be heading out to DC as much as needed. But prior to this, I worked at some policy consulting with Inclusion Nation, and then I worked at the law firm of Jenner and Block doing talent development, inclusion, legal recruiting work. But my most important work that really brought me here is my work that I've done with the National Multiple Sclerosis Society. I had a leadership volunteer role with them for many years. I was chair of the Illinois Government Relations Committee, and also I'm incoming chair of their National Activism Advisory Committee. And I'm just very passionate about people that live with disability and chronic illness, like myself, since I was diagnosed with multiple sclerosis in 2012. So that is about me. I have 2 little kids and a fur baby that keep me running around.
Thank you, Angel. Angel will be charged with, in this brand new role of representing the foundation among our 6 to 8, 10 coalitions that we're a part of. And she will become not only an expert in issues outside of our priorities, but also remind us things that are happening at the coalition level. So we're really, really grateful that she's a part of the team. I think now I'm going to pass it along to my colleague John to talk about recent Supreme Court decisions.
Thank you so much, Kim. And on behalf of everybody else on the panel, Angel, it's wonderful to have you here. And we're just really looking forward to working together. And thanks to everybody who's joined us today. We realized in putting the next few slides together that it had been several months since we had a group of us together and had a webinar of the regional champions. And so the first thing we wanted to do when talking about the Supreme Court was acknowledge and share, obviously, the important news that there is a new justice who will take her seat on the Supreme Court actually at the end of this term. And that is now Justice-elect, I guess, Ketanji Brown Jackson. Her previous experience was as a judge on the U.S. Court of Appeals for the DC Circuit, and she was confirmed by the Senate a couple of months ago. But that will change not necessarily the ideological makeup of the court, but obviously with only 9 justices, every justice on the court has their own impact in different ways. June is the time where a lot of the most consequential Supreme Court decisions are handed down. This has obviously been in the news, and so we wanted to go over some of the more consequential decisions that have been made, but also decisions that we're expecting over the course of the coming days. Typically, the court finishes issuing those decisions by the end of the month, but nobody actually has a total window into when they will issue specific decisions. But first and foremost, I'm sure that everyone has been following to some extent the court's ruling in Dobbs versus Jackson Women's Health Organization. This was issued last Friday, and the biggest takeaway from this decision, which concerned abortion rights is that the court, by a 6-3 ruling, overturned the precedent set in 1974 by Roe versus Wade, and held that there is no longer a federal constitutional right to abortion services. Going forward, it's important to state that abortion rights now will be determined by state governments, unless there is a federal legislative action by Congress that would preempt those state actions. Between the passage of, or the ruling in Roe versus Wade and last Friday's ruling, about half of states adopted or are planning to adopt laws that would go into effect pending a court decision along these lines. And so that is really playing out as we speak. A number of states have already passed laws or are implementing laws that were already passed and have been on the books since pre-Roe, basically outlawing abortion in those states. Other states where abortion remains legal are passing and considering laws to expand access. Though some of those, in some of those states, there have been challenges filed in court to some of those trigger laws that have paused enforcement. I think one thing that we wanted to share is that the Department of Health and Human Services has stood up a new website. The link is here on the slide, really to try and serve as an information hub regarding access to reproductive health care and resources, especially in light of such a monumental change, I think, that's playing out around the country. We did want to acknowledge and walk through quickly a number of other significant Supreme Court cases this term, both ones the court has ruled on, but also ones where we're expecting a ruling. So in the first case listed here, the court made a 6-3 decision around Second Amendment rights and struck down New York State's concealed carry law based on interpretation, and this is not where we live and breathe these legal analyses, but this would have a major effect on any state law that attempts to regulate the possession of firearms outside of the home. So that's a pretty big decision in the context of Second Amendment law. In the healthcare space, American Hospital Association versus Becerra, the court overturned cuts that were made in 2018 to Medicare payments to certain hospitals. And for those who are paying attention to the details on hospital payment, those were to hospitals that participate in the 340B drug discount program. And the court basically found that Medicare cannot arbitrarily choose payment rates for specific hospitals based on their participation in other programs. A decision that's expected any day is West Virginia versus Environmental Protection Agency. There has not been a ruling yet there, but West Virginia is challenging really not just the government's environmental regulations, but actually the federal government's underlying ability to issue regulations related to environmental quality. And so this has major implications not only for environmental law, but actually for the entire sort of field of regulatory law and how much the federal government can actually issue future regulations in any area, and where the courts will set a precedent of being deferential to federal agencies on these kinds of issues. And then the last one to flag, also not yet ruled upon, is the case of Biden v. Texas, in which the court is considering an attempt to overturn the Trump administration's remain in Mexico immigration policy. And so the Biden administration has been attempting to change that policy. States, including Texas is taking the lead, but a number of state attorneys general have been suing to prevent that change in policy, and the court is set to rule on that. And again, as you all know, we focus largely on legislative matters and things coming out of the executive branch, but we wanted to run through all of these because obviously the Supreme Court has big implications for policy, but it also has implications for what issues will be on the priority list for those other two branches. going forward. No one can really know yet how some of these big monumental Supreme Court decisions will translate into the congressional priorities and the administration priorities. But the one thing we can be certain of is they will change those dynamics. And so we wanted to walk through those. But I think now we want to pivot back to Capitol Hill. And I'm going to turn it over to my colleague Celicia to talk about some of the congressional pieces, and then Kim will talk about a few, and then I'll come back.
Awesome. Thank you so much, John. And again, thank you all for being here. I think one piece is from what John shared, a lot of the Supreme Court decisions were very front and center within the news. And on the other hand, Build Back Better, not so much so, a little bit on the quieter side. So I'll just share a little bit there. We know that there's been a number of conversations over the past several months regarding the Build Back Better legislation, or also known as the reconciliation deal. Initially, as far as timeline goes, last fall, there were thoughts and murmurs around Build Back Better legislation potentially passing alongside the infrastructure bill that was passed in this past fall. However, that was not the case. There were still a number of conversations that were happening and disagreements. Folks, of course, then hoped that there would be potential passing before the winter break. That also did not happen. And so conversations have been ongoing. And at times there have been thoughts that not a lot of movement was really happening. We're hearing again that there has been some more promising negotiations that have been happening, particularly among Senate leadership. Although there are some hopes that a deal could either be reached, or a framework of a deal could be reached prior to this 4th of July recess, or hopefully before the August recess. A big piece of that, as far as some of these negotiations go, is actually connected with Senator Manchin. In terms of a possible deal with Senator Manchin, it's sort of centered on 3 key pieces. One is the tax code changes. The second is around climate and energy investments. And the third around prescription drug pricing reforms. And part of the big pieces there with Senator Manchin is that with a really large spending bill like this, with the Build Back Better legislation, there should be elements of it that are what's called pay-fors that can actually help in sort of supplementing all that would be spent on these other programs. The overall Build Back Better legislation largely focuses on a lot of areas connected to healthcare and to the climate and environment. And so thinking about those tax code changes and thinking about prescription drug price reforms, there's a potential opportunity for saving some money as opposed to a lot of spending. However, even with all of that being said, and a potential deal with Senator Manchin, the overall outlook for this Build Back Better legislation is still fairly unclear. There hasn't been any official deal that has come out of this, or a framework for a deal that has come out of this. And we know, as the picture shows, the clock is ticking, the calendar is moving forward. As we get into August recess, it seems like that month will be particularly determinative in terms of whether or not this Build Back Better legislation will actually move forward. So our team will, of course, continue to keep a close eye on that. But unfortunately, it still very much seems it's in that limbo stage. On the other hand, I guess similar to some of the Supreme Court decisions that have come out that has been top of mind on the news, another big piece that has been very central on the news lately are these other sort of legislative updates, one of which is connected to January 6th. So the select committee that's investigating the January 6th attack on the US Capitol has now held a number of hearings that has helped to shed a little bit more light on the activities of that day. There was I guess what folks have been calling a surprise hearing that happened just yesterday that shed light particularly on actions by the former president and what seemed to be concerning as far as any violence against a Secret Service agent as well as potential tampering with evidence. So there is still a number of questions around this overall investigation and what pieces of evidence are fully definitive right now versus what might need more information for folks in terms of learning throughout this whole process. It's been a very fast moving set of hearings, but that is still something that has been very top of mind for a number of people and has been watched by millions of Americans. A second piece that I think has shed a little bit more positive light following the really tragic mass shooting at the school in Uvalde, Texas, senators were able to reach a bipartisan gun safety deal, which there were a number of pieces of the gun safety legislation that did cause some delays in the final agreement. One part of that is called what's known as the boyfriend loophole. Initially, for those who were in domestic abuse cases, would be banned from having access to a firearm if they were married to that partner in which they were involved in that case. But that would, of course, leave out any intimate partners that were not married to each other. And so part of this particular provision in the law is that those in any sort of intimate partner relationship would also be banned from having access to a firearm if they are involved in these domestic abuse cases, but may have an opportunity to regain that access after about 5 years, as long as there are no other sort of pending cases against them. So that is one piece that required a lot of negotiations amongst senators. The second piece of that was around states implementing red flag laws and questions, particularly around funding going to specific states that may not want to have additional red flag laws, or how those might be put together. And the last piece that required additional sort of negotiations was around enhanced sort of scrutiny and background checks for buyers of firearms that are under the age of 21. It looks like for the most part within that legislation, those different pieces were able to come to an overall deal on. I know that each side felt that they had to do quite a bit of compromising to get there, but it is great to see that a deal was able to come out of that. In addition to those pieces, specifically on gun safety, there was also quite a bit within this legislation related to new spending for mental health and mental health treatment, as well as on school security. And some of that is also connected to community clinics and access to more providers. So the legislation has a lot of very positive pieces in there that hopefully will have a very positive impact on folks moving forward, and was signed into law on June 25th. On the other side, where things are not moving as quickly, is related to COVID-19 funding. There's been a lot of conversations about potentially having additional funding for COVID-19 treatment, for testing, for vaccines, but that's been stalled. Part of that has been related to other provisions related to immigration, and unfortunately has just caused an overall halt in moving forward with COVID-19 funding. Separately, though, related to COVID, there has been a lot of increased interest amongst members in Congress and within the NIH and other agencies related to investing more resources and research related to long COVID. A number of people have been impacted by long COVID, and there are still a number of questions around what that actually means long-term for people's health. More and more people at this point, as they are getting COVID, there's less concerns about mortality, which is fantastic as far as what we've been able to do with treatments, testing, and vaccines. But there have been a lot more questions related to the impacts of long COVID. And so that has been something that we've also been watching, just as far as whether or not there will be continued interest in this going forward and research. So those are a lot of the various legislative pieces that have also been having quite an impact in our news feeds and also broadly on people day to day. But I will pass it over to Kim to share a little bit more about other specific legislation.
Thanks so much, Salicia. I wanted to just piggyback a little bit on what you were talking about when you gave us a summary of what was happening or not happening with Build Back Better. I just wanted to remind everyone, for those who may not remember, why that legislation was so important. We worked really hard as a disability coalition and community to include funding for home and community-based services. And there was a large investment initially by the administration pushing Congress to include hundreds of millions of dollars for home and community-based services. And this is why we really were tracking that legislation. We know that caregiving is a huge crisis, a huge issue for our community. We will continue to find ways to educate Congress about this need. And that's why we wanted to make sure that you are continually educated on that. So let's just move on to the ABLE Act. The ABLE Act, if you remember, the foundation was involved with advocacy around the passage of Achieving a Better Life Experience, the ABLE Act, which allowed individuals to set up savings programs, opening up accounts that would not jeopardize their benefits. So they could save $15,000 up to $100,000. This initial legislation limited the age in which someone would acquire disability in order to open up this account. It was set at age 26 and prior. In June of this year, just last week, the Senate Finance Committee moved to include language that would expand that age to 46. So we've been working with Senators Casey and Senators Moran to advocate for inclusion of a larger vehicle that would move this legislation to expand the age, because obviously there are many people that are left out of this benefit, and we want to make sure that as many people can access these accounts as possible without jeopardizing any benefits they may receive from SSI and other places. And I want to talk just briefly about some additional legislation that Reeve has lent our name of support to, that will continue to track with Angel's help, and of course our colleagues at Waxman Strategies. We recently signed on and are pushing Congress to include the Improving Seniors Timely Access to Care Act. There's important pieces of this legislation that would address the prior authorization, especially within Medicare Advantage plans. So we know that Medicare beneficiaries can access certain supplemental plans, and we're seeing that individuals, especially those with disabilities, are having to access a prior authorization before receiving care. So we want to ensure that those barriers are removed, and this legislation would address that. So we'll continue to monitor that. We know that's a really important issue. We know that our community encounters many barriers when they're navigating the healthcare system, and specifically insurance and Medicare as well. The second piece of legislation, and that was introduced, I just want to make sure that I have, that was actually Representative Delbaney, and the reason why I wanted to highlight her is she's a Democrat from Washington State, and one of our regional champions has a wonderful relationship with her. She has continually supported the Paralysis Resource Center funding. So we were really glad to see that she's also leading efforts around Medicare insurance. Improving Medicare insurance for beneficiaries, including those with disabilities. The second piece of legislation that I wanted to highlight was around the SSI Savings Penalty Elimination Act. This was introduced by Senator Sherrod Brown. And as we know, the Social Security Income Program offers critical support for millions of Americans who take advantage of this important program. However, the rules require that individuals basically have zero assets in order to access these benefits. This piece of legislation would raise the asset limits for individuals who are utilizing the program. So we'll continue to monitor that. And the third legislation that was introduced on the Senate side has already been introduced on the House side is the Eleanor Smith Inclusive Home Design Act. We don't have a Senate number yet, and I can provide that information in the follow-up email. This was also introduced by Senators Casey and Senators Duckworth from Illinois, and it's to help ensure that all newly constructed family homes built with federal funding include one accessible or zero-step entrance. Doorways that are wide enough for a wheelchair, and that one wheelchair accessible bathroom and light switches, as well as the thermostat that are reachable from a wheelchair. Companion legislation, as I mentioned, was introduced by Congresswoman Jan Sukowski, a Democrat from Illinois, in July of last year. That's HR 4695. And this legislation is named after Eleanor Smith. She's a leader in the 30-year movement to ensure that all new homes are visitable by mobility impaired individuals. So we'll keep you posted on some of this legislation as if it may move through Congress this year. So I'll pass it back to my colleague John to talk a little bit about an update since we carefully track many aspects of appropriations. Thanks, John.
Sure, thanks, Kim, and thanks everybody. I know we're covering a lot, but I think what we really want to do is give you as full a picture as we can of all the different moving pieces that are happening here in Washington right now. And one of those that's always at some stage in its annual process is the federal budget and appropriations process. And as folks who've been on these webinars before know well, that's the process by which, starting with the administration, they start with a proposal for the budget for the year, really down to the program by program, what are called line items. And then Congress moves through its process in the House and then in the Senate, and then they come up with a final deal, oftentimes, most of the time, missing their deadline of the end of the federal fiscal year. But it's really an important process by which funding levels are set for a number of different programs, including, I think, at the top of the Reeve priority list, the Paralysis Resource Center, which is a federal program that is operated by the Reeve Foundation, but that provides a number of different resources to folks across the country who are living with paralysis. So this year, the fiscal year 2023 budget process kicked off earlier this year with, always begins with the release of the president's budget proposal. That came out this year in early April. Emphasis on proposal. The president's budget is always what the president and the administration would like to see in terms of funding for different programs, but it is Congress who makes the ultimate decision there. That proposal looked really good from our standpoint, specifically for the PRC. The president's budget called for just over $10 million in funding for the PRC, which would be a slight increase over last year's funding level. One thing that is used almost every year to build support within the congressional process for specific appropriations requests is what's called a Dear Colleague letter, where members of Congress, in our case, Congressman Jim Langevin of Rhode Island, as well as Congressman Brian Fitzpatrick of Pennsylvania, they lead a letter that goes to the Appropriations Committee. And the letter basically says, we are in support of this program, and in our case, the PRC. We would like to see the committee fund this program at X level. In the case this year, it is that same level that the president called for of 10.185 million. And then other members of Congress can sign on to that letter to show their support. And so this year, we were happy to see that the letter gained the signatures of 27 other members of the House, 27 total members of the House. And really huge thanks and kudos to the advocates on the call, other advocates around the country. There were both action alerts that went out on the Dear Colleague letter, as well as a lot of one-to-one outreach, I think, coming from the regional champions. So I think that really helped communicate to the House Appropriations Committee the broad and bipartisan support for the PRC. So where are we now? Actually, where we are now is things are very much in motion. So we'll talk about that in a moment. The House Appropriations Committees are in the midst of marking up funding bills. And marking up just means they go through each bill and offer amendments, speak on different priorities, and eventually pass these bills out of committee. So the House is expected to pass all of its 12 separate appropriations bills out of committee by the August recess. The Senate is expected to take action a little later in the year. But as in past years, It's not expected that Congress will finish all the negotiations over appropriations by the end of the fiscal year, the current fiscal year, October 1st. And so we expect that they will pass what are called continuing resolutions, at least one in October until after the November elections. And basically a continuing resolution is putting all government programs on autopilot and basically continuing them at current funding levels. Beyond the PRC, which we obviously are paying close attention to, there's a number of other priorities that the foundation tracks and weighs in on, including the SCI Model Systems program that exists within ACL, the Administration for Community Living, as well as research funding at the National Institutes of Health and other key priorities. So this process is sort of right in the middle of happening. The picture here, because it doesn't look like your average committee hearing, you can see what this is actually like, a really working process where everyone's sitting with all the various documents and really going through, and these markups can last a number of hours. So that's where we are. Kim, do you want to update on what we heard this morning, or do you want me to share that as well, or is that on a later slide?
Yes, would you mind sharing that? Thank you, John.
Sure. Just because this is all happening in real time, the House is expected to pass its full committee version of the funding bill that funds the Department of Health and Human Services tomorrow. That legislation was released publicly today ahead of tomorrow's markup. And we're really pleased to report that the committee in the House also included that funding level of $10.185 million for the Paralysis Resource Center. That's a really, really good and strong first step in the process. It comes as the result, as we said, of advocacy, both on the Dear Colleague and directly with the committees and their staffs. And it puts us in a good position going into the Senate negotiations that are ongoing and into the final product. So that's hot off the presses, and we're really looking forward to the rest of the year and the process. So let's just talk for a moment about the rest of the year. We've mentioned the appropriations timeline on the side here. The House really looking to wrap up its committee work by tomorrow. And then appropriations legislation will be considered one by one on the floor of the House for the first few weeks of July when the House is back in session. As we said, the Senate's plans are a little less clear, but the committees are expected to act this fall, at least to put a marker down before Congress goes on recess ahead of the elections. Stepping back a little bit to talk about the larger congressional calendar here, what you can see here, and apologies for the very small text, but we just wanted to give you a sense of when Congress is expected to be here and when they're not over the course of the next 6 months or the last half of the year. Congress will be in recess next week for the July 4th holiday, as well as for almost the entire month of August. The yellow blocks on the graphic here are when both House and Senate are in session. The blue blocks are when just the Senate is expected to be in session. So there's some overlap there. But August, as is true most years, is the time when most members of Congress go back to their districts and work from back in the district for almost the whole month. It's a great opportunity, and I think we'll have some resources for this, for advocacy visits with your members of Congress. There's oftentimes lots of public events during August, and that's a great chance to connect with them directly. They'll come back, and really, I think there will be several weeks of really rushed work before the end of the fiscal year, again, presuming they will include a continuing resolution there that passes sometime in September. And then in October, you can see that the House will be out. The Senate is currently scheduled to be in for a couple of weeks, but I think that is fair to say it's up in the air because in early November, on the 8th, are the midterm elections. And so typically Congress will go back for at least a month before the elections so that the members who are up for election can be campaigning and back in their states. And then following the elections, there is a scheduled what's called lame duck session essentially when Congress comes back after the current Congress comes back after the elections have taken place, but before the new Congress is seated. And a lot of work actually gets done in that session to try and sort of clear the decks for the next Congress. But in terms of things that we've been watching as big priorities, as Celicia said, the Build Back Better legislation and other big pieces, the conventional wisdom is that on major issues, they're going to need to see action before August if they're going to have a chance of passing, largely because, you know, as you get closer and closer to the election day, it becomes harder and harder to finalize a lot of this legislation. So with that, it's I think maybe a good segue back to Kim to talk about the grassroots and a number of updates from around the country.
Thank you, John. And before we get into the grassroots part of the webinar, I just want to make sure we just covered a lot, about three months of activity in a half an hour or so. So if there's any questions, please feel free to fill out the chat box or the Q&A section. Just give everybody just a second. Of course, we're always here to answer any questions. Okay. On June 7th, the foundation was thrilled to honor Congressman Jim Langevin. Many of you, of course, know him as the first wheelchair user to work in Congress as a congressperson, as a representative for the state of Rhode Island. He announced his retirement at the end of this term. He has served in Congress for over 20 years, really leading all efforts to protect and advance disability rights for people with all ranges of disabilities. And we have a wonderful relationship with the congressman, and he has led, our dear colleague led our for the last 4 years, and has introduced various pieces of legislation to improve the lives of all people living with disabilities. And so we were able to honor him in Washington, D.C. Christopher Reeve's daughter led a committee of colleagues, wheelchair users, and other supporters of the Reeve Foundation to plan this event. And it was just really a wonderful time to have him come and be acknowledged for all that he's done. He shared very warm words and stories about knowing Christopher and Dana. And we really hope we can continue to work with him after he leaves Congress. So I just wanted to share this wonderful picture of him. You may have received, I know the foundation, we love a survey here at the Christopher and Dana Reeve Foundation. So we're very grateful that you are consistently taking our surveys. We really do utilize this information. We recently joined efforts with United Spinal Association to write a survey around understanding the rehabilitation experiences for those who have spinal cord injury, traumatic and non-traumatic spinal cord injury. We're trying to understand the experience of someone recently, and even the individuals who have been injured long ago or suffered or sustained any form of spinal cord injury before 10, 20 years ago. We're trying to understand all this information because we're hearing more often than not that individuals are not able to access proper rehabilitation, inpatient rehabilitation, and are often sent home way earlier than often is very dangerous. So we will share the results of this survey. I think we have nearly 400 responses. I think it's open a little bit longer. United Spinal Association had their role in Capitol Hill last week, and I think they're keeping this survey open just a few days longer. So if you haven't taken it, please do, and we'll share the results on a future webinar. I want to give a little bit of update since we last spoke about some of the activities and all the fruits of your labor. You know, we can track all the activity that our advocates take, and John talked a little bit about the Langevin-Fitzpatrick letter, and I just wanted to highlight all the activity and all the action that you took to get those representatives to sign on. You know, it's no easy feat to have. Members are flooded with these requests, especially during appropriation season. So we're really thrilled to see how active our advocates are. We had 632 advocates reach out directly, sending nearly 2,000 emails. And the other request that we had wonderful input from is around the U.S. Access Board. I know we've talked a little bit about accessible medical diagnostic equipment and how we're hoping the Department of Justice will enforce these guidelines so individuals can access healthcare, that anyone can access healthcare, anyone can be weighed, get onto an examination table, access their screenings. These are barriers that people with disabilities face every day when they're just going to a doctor's appointment. The U.S. Access Board is seeking input from the community around the height of a table. And you would think like, oh, that's interesting. I never really thought about that. Well, it is very, very important for individuals who may be transferring from a wheelchair to the table. So we put out a call and U.S. Access Board was flooded with input from the community. So I want to thank you for for responding to that request as well. I just want to check one thing. I think I have one question in here. I want to make sure I answer it. When was the study sent out? The study request was sent out probably in about 2 weeks ago. We'll resend it out again 2 to 3 weeks ago, but we'll make sure that it's in the follow-up email to our webinar. And then, yeah, okay, great. In light of Disability Pride Month and also, of course, the 88th anniversary was celebrating that 32 years after it was signed into law in 1990. I will be co-moderating in this awesome webinar with our Reeve blogger, Stephanie Woodward, who works with Disability Empower Network. And we will be hosting a webinar on how women with disabilities can run for office and how you can too if you're interested. We'll be highlighting the work of Representative Jennifer Longden from Arizona and Councilwoman Mary Zendejas from California. So we're really excited about that. That's on July 12th. Be sure you have the sign-in information. I hope you can join us for that. And then as always, again, I want to thank all of our advocates for being so attentive to our many requests, our surveys, our action alerts. All of your work really matters. We're really proud to work with you and we always want to hear your input, suggestions for improvement, but you'll be getting information as throughout July for Disability Pride Month. We will be sending an action alert. John was talking about how the House is close to voting, hopefully on final legislation, final votes for the Department of Health and Human Services funding. So keep your eyes open for an action alert around that. We're hoping, I know we mentioned this in past webinars, and I may dedicate some more time the next time we meet around an important national coverage determination. We've been advocating for changes at Medicare to cover seat elevation and standing feature, which some insurance payers believe are accessories to your wheelchair. In fact, they're critical components that can really help with improving your medical health, your health, and are considered medical in nature, in our opinion. And there will be an open comment period. We're waiting to see when Medicare will open this up, and we will provide information. We may hold a quick webinar call about how you can offer your comments around having Medicare cover these really important pieces of wheelchairs. And then finally, next week, we'll be welcoming a new grassroots advocacy manager. His name is Gerard. He will be reaching out to you as soon as I'll have him reach out to you on his first day, which is Tuesday, right after the holiday. And we're really thrilled to have him on board, and he will be on our next webinar. And I think that's it. So again, I want to thank all my panelists for participating. I want to thank all of you for joining, and thank you all for your continued advocacy. And let me just double check the questions. And I don't know if my fellow panelists have anything to add.
Kim, we have a great comment in the chat from Al about participating in Roll on Capitol Hill and his meeting with Congressman Langevin and discussing issues we've talked about as well in the past, the Air Carrier Access Amendments Act, as well as SCI model systems. So Al, thank you for that, and hopefully that you got the bug and you'll come back to DC and advocate in person in future years.
Yeah, that's great. That's great. I know many of our advocates work with many other organizations. We are trying to work more closely with United Spinal. A lot of our advocacy priorities overlap. Please stay tuned for some additional information about, hopefully we're going to be holding our advocacy virtual summit in September. September is shaping up to be a very busy and chock-filled month for our Spinal Cord Injury Awareness Month. So lots ahead for us. We can't let up. We have to continue. So appreciate that comment, Al. And if there's nothing else, I think we can log off. We'll give you back 9 minutes of your time. Thank you so much for joining us. Any final words, my fellow panelists? Happy July 4th.
Thanks, everybody.
Take care.
Thank you. Bye.